Hello everyone, it's your friend Doris Decoder back with another video, and as promised, this is a shout out video. This week's shout out is Shim Spine on YouTube. Again, every video I give you, every shout out won't necessarily be on YouTube, but for me it's very important to give you resources that don't cost you anything because not everyone has the economical resources available to find those channels. I will always give you sources that I found helpful. Now, I'm a little bit of an anatomy geek, so I like anatomy, and sometimes that makes things a little bit easier to understand. But I'll refer you to sites and channels and references that I find make the information understandable at a coder's level. Every channel that I see or run into, I wouldn't necessarily recommend. Not because it's not a good channel. There are some coders that have medical experience as well, but for the average coder that is not at a clinical level, some of the channels are by clinical providers or practitioners, and they're developed for clinical practitioners. So they really speak at that level, the base is at that level, and it might be a little bit overwhelming, not as understandable or above your head. So this week's shout out is Shim Spine. You'll find this video helpful if you are, this channel helpful if you are a coder who codes bony neurologic procedures, things like discectomies. You might find it helpful if you do spinal orthopedics. The author or owner of the channel, Dr. Shim, is in Oldsmar, Florida, and he is actually an orthopedic spine surgeon. So only if you're doing spinal orthopedics, I think you'll find that orthopedic part helpful. You won't find, knee joints and shoulders and anything on Shim Spine's channel because that's not the scope of this physician's practice as I understand it. You will find helpful information about diagnostic videos. He's got a lot of content. Diagnostic videos like what is sciatica, what is a non-union. For the sciatica, when you see pain that radiates down the leg and the physician hasn't said sciatica, I know as coders we look for things to be explicitly documented so we don't feel like we're giving a patient a diagnosis that they don't have, and that is important because that has medical and financial implications for that patient. But knowing what it is can cause you at least to query your physician and have the record updated to include the term sciatica if that's something that you're accustomed and you're wanting to see in your documentation. So diagnosis videos like what is sciatica, what is non-union, what is spondylolisthesis, he's got those there. What is pain? Also some procedural videos that I found specifically helpful, like discectomy and the lumbar discectomy, and the what is a facet injection. So again, you're going to find utility if you also code interventional pain management, and your provider does facets and epidurals. He has an epidural video as well. I also found the video "The Correct Words Matter" to be very helpful because it really is more of a comfort video in my mind, because I think for us to have agreements as coders, and we don't always agree, we have to understand that sometimes physicians don't kind of always agree in what they call things. He identified a source that I was not aware of that I'll certainly be referencing, that physicians use to kind of align their language. So they aren't calling this one condition two different things because those two different things are looked at different by physicians in the same specialty. So again, this week's shout out is Shim Spine, and I hope you find it helpful. He is on YouTube. I will ensure to include the link to the channel down below in the description box, so just expand that if it's not showing, so you can go directly to his channel. And as always, thumbs up if you like it if you do. Give me a comment and feedback if there's any other resources that you are looking for specialty specific that I might be able to help with. I encounter a lot of channels on YouTube. I don't always recommend them, just because sometimes they're just a little too clinical for me. Doesn't mean you won't like them, but I refer the ones to you that I've seen, that I've used, that I've referenced, or that I found helpful in one way or another. Sometimes they're telling me things I already know because I've already kind of learned it, but I think wow, I wish I found this, or this video was available when I first started, or I was looking for it. Share the video if you find this content helpful with someone that you think would also find it helpful. And always subscribe. If you subscribe to the video, then when I post like now, you will be notified. So if this is your first time to my channel, welcome. And if you're returning, thank you for coming back to see me, and I will see you in the next video. Thanks for visiting, and I'll see you soon.